I'm Daniel Levine, and this is the Bio Report. There's been dramatic progress in the understanding and treatment of relapsing remitting multiple sclerosis, a debilitating neurodegenerative disorder. But progressive MS, a more advanced form of the disease, has remained elusive. Now, a novel collaboration has brought an international group of MS societies together to fund research. We spoke to Bruce Bebo, Executive Vice President of Research for the National MS Society and a member of the Progressive MS Alliance, about the intractability of progressive MS, how the unusual cooperation between MS groups came about, and whether the alliance will stand as a model for groups working in other disease areas looking to get the most out of their research investments. Bruce, thanks for joining us.
It's a pleasure to be here, Daniel. Thanks for having me.
We're going to talk about an unusual alliance among a group of organizations focused on multiple sclerosis and how they've come together to spur needed research into a largely unmet medical need, progressive MS. I think it would help first by explaining what MS is and how the progressive form of the disease differs from what most people may think of relapsing remitting MS.
Right. So, multiple sclerosis is a chronic neurological disease that can be disabling, and it is characterized by the destruction of the nerve insulating myelin sheath, the sheath of material that insulates nerve axons and nerve cells and allows for their ability to conduct electrical activity in the nervous system. And it's thought that at least relapsing forms of MS are caused by an immune reaction that recognizes this myelin sheath as being something dangerous and attacks it and strips it, and the resulting disability comes from the disruption of electrical signals in the nervous system. And relapsing forms of MS can be, or there are effective treatments for relapsing forms of MS that all of which affect some aspect of the immune response. And those agents that are effective in relapsing MS many have been tested in progressive forms of MS and shown not to be effective in progressive forms of MS. And that is an important clue that we have that of the differences between the relapsing form of MS and the progressive form of MS, that the relapsing form is characterized by inflammation in the nervous system that destroys myelin. The progressive form is not. And the progressive form seems to be characterized biologically by a process called neurodegeneration, where the nerve cells and their projections, their axons, gradually begin to not be able to function and gradually die and shrink, and loss of function and disability due to a neurodegenerative process that may be in some ways similar to the neurodegenerative processes that occur in other diseases like Alzheimer's disease or Parkinson's. Some similarities between progressive forms of MS and these other neurodegenerative diseases.
And I take it most people with relapsing MS go on to develop the progressive form of the disease.
So many people with relapsing remitting MS may progress to a progressive form of disease called secondary progressive MS. The exact number or proportion of people that develop progressive forms from relapsing forms isn't exactly clear. What I can have confidence in saying is that somewhere around half of MS patients are in a progressive phase or progressive form of disease.
Well, Why do you think we've had a large number of drugs come to market for relapsing remitting MS, but nothing of significance to treat progressive MS?
Yeah, that's a great question, Daniel. So there are a number of challenges that we're working to overcome to solve the problem of progressive MS. One of which includes the lack of a good animal model for progressive disease. For many years, there's existed a animal model of relapsing disease that has been invaluable to the scientific community to understand aspects of relapsing disease, and all of the therapies that we have currently for relapsing disease have been tested in that animal model and were shown to be effective in that model, and it's been invaluable, and we don't have that for progressive disease. And that is one of the priorities for the Progressive Alliance, is to spur research and promote research in developing new models that can help model some aspects of progressive disease. Another roadblock we have in developing treatments for progressive disease is a lack of good clinical outcomes measures for proof of concept clinical trials. So any agent that has been tested or approved for relapsing disease goes through a phase of development called proof of concept, which is actually treating patients with your drug in a smaller clinical trials. And for relapsing MS, there's a good measure to measure the effectiveness, and it's an MRI imaging measure. And we don't have that for progressive disease. We don't have a good, accepted, validated outcome that tells us an agent's working for progressive MS. There are some candidates, and they're being studied vigorously and aggressively, but we don't have that yet. And that is another one of the focus areas for the International Alliance. The other, I think another roadblock is, and it's not very, I guess I would say it's not very sexy, but it's incredibly important. We don't really know the best way to design a trial, a clinical trial for the ultimate testing of an agent for progressive disease. There are a lot of people doing clinical trials and testing various designs and how we're going to conduct one of these trials, but that's another really critical aspect, is because we haven't had one that worked, right? We haven't had a clinical trial that's worked for progressive MS. We don't know exactly, how that design's going to look. And then, again, maybe even the most important aspect is we still don't really understand the fundamental biology of progression, and the paths and the trigger points for being able to stop or slow down that progression still remain elusive, although we're making progress.
Certainly gives you some big areas of inquiry that you'd be interested in pursuing, but how did the Progressive MS Alliance come about, and what was the thinking behind it?
Well, so the Progressive Alliance, the genesis of that was from a meeting that the National MS Society sponsored in Washington, D.C. I think it was maybe 3 years ago now, that brought in thought leaders from around the world, realizing that there was just this terrific unmet need to make advances in progressive MS research. Every time we have a new and wonderful new treatments for relapsing disease that have changed people's lives, it leaves half of people with MS to half that are living with progressive forms of MS behind. And it's just reached a tipping point where we really had to do something, out of the box, and transformative. And the evolution started with some meetings with key thought leaders from around the world, and that was in Washington, D.C. 3 or so years ago. And it involved the recruitment of MS experts into work groups to really examine where the unmet needs were, where the roadblocks were, provide the Alliance advice about our scientific focus. That culminated in a meeting about 2 years ago that took place in Milan, Italy. And I think that meeting in Milan was probably the birthplace, I think, of the Progressive Alliance. where we had almost 200 scientists. We had people in that meeting that had a personal connection to progressive MS, and healthcare experts all gather in one place for several days to develop this plan that we're now implementing, called the Progressive MS Alliance. I think that's when it was born, was in Milan, Italy, a couple of years ago. And the dramatic, 2 years seems like a long time, but it has been a very fast path to get where we are now, to have developed the strategies, to recruit the experts, to call around the world for applications for applying for research support, to this day, to actually awarding these grants. It's been, we worked with an incredible sense of urgency, and it's an amazing collaboration amongst all MS societies from around the world that got us to where we are today.
Were there challenges to overcome in getting these groups to collaborate?
I think the will was always there. And there's incredible will amongst all of the MS societies to participate. There are always challenges to launching a brand new effort that's never happened before, but they were all overcome because there was such a strong will and such an urgency from all of our respective constituents to do something different, to do something really big, that they were easy to overcome. I'll tell you, my biggest challenge is I live on the West Coast, and that means I have to wake up at 5 a.m. to be on conference calls for the Alliance. And we just had, just this week, the Executive Committee of the Alliance approved a new managing member from Australia, so that's going to get even more challenging, having Australia and Europe and East and West Coast in the U.S. So I may be getting up earlier than 5 for the next conference call.
How unusual is it to see a group of international disease-focused organizations come together in this way and pool efforts?
Yeah, I mean, this is a one-of-a-kind effort for multiple sclerosis. It hasn't happened before, and there are no other ongoing efforts that I'm aware of that are similar to this. When you're asking about other diseases, I'm probably not. I don't know enough to answer the question. But having been, working on this project for the last 2 years, I mean, I think this is very unique and perhaps not one of a kind in the world of all scientific efforts, but it's definitely unique in MS.
How big is the organization, and what is the demand on its members? How much funding commitment do they make?
Right. So the way the Alliance is organized, there is an executive committee that consists of the chief executives of each of the managing members of the Alliance. And the managing members include the United States MS Society, the MS Society of Canada, the United Kingdom, Italy, and Australia, and also the Multiple Sclerosis International Federation. And each of those organizations' key lead executives have a seat on the executive committee. The chair of that executive committee is the CEO of the U.S. National MS Society, and that is the group. That's the group that has the decision-making power on the Alliance. So somebody has to make a decision, and it's that group and that makes decisions. There are a number of committees that advise the executive committee. The one I serve on is the scientific steering committee. It's led by two of the most well-regarded thought leaders in MS research in the world, Alan Thompson, who's from the United Kingdom, and Giancarlo Comi, who's from Italy. I mean, a lot of our success is to their credit and their leadership, and getting the scientific community to buy into this effort. We have the scientific steering committee is composed of, I think, maybe about 20 or 25 people. These are scientific volunteers from each of the managing members' countries, and the lead scientific staff from each of the members of the Alliance that serve on a scientific steering committee. And then there are a number of other committees that are focused on communications, that are focused on fundraising and other aspects of the alliance that include volunteers and staff from each of the member organizations of the alliance.
We had talked about some of the scientific challenges that coming up with therapies for progressive MS face, but has the organization prioritized research?
So research is the whole point of the alliance.
Well, forgive me. In terms of the types of research it's trying to fund.
Yeah. So these our scientific advisors are members of the scientific steering committee and other scientists. And again, this came out of the meeting in Milan that I mentioned earlier, where I've identified several priority areas based on the unmet need and based on the probability that progress can be made and advances to treatments for progressive MS can be made. And these priority areas include a better understanding of progression, so the basic biological mechanisms that are driving progression, so that we can identify targets that can be help us develop new treatments. Another priority area is designing shorter and faster clinical trials, like I mentioned previously, that not only measure clinical outcomes but take into account patient outcomes as well. Another of the priorities of the alliance is to actually support the conduct of clinical trials to test new agents, and finally, to develop and evaluate new therapies to manage symptoms. So until we have a disease-modifying treatment for progressive forms of MS, there are many things we can do to reduce symptoms and improve the lives of people living with progressive forms of MS, and that includes rehabilitation. And I think there's a lot of interest in developing rehabilitation techniques to improve the lives of people living with progressive MS, and that's another part of the focus of the alliance.
Well, today the organization announced its first round of funding. It's $30 million in awards to 22 projects. Can you give a sense of how much competition there were for these awards and the range of projects that got funded?
Yeah, so we had 195 applications from 22 different countries. And Daniel, I have to say this surprised me and blew me away, honestly, the number of applications that we received and this incredible demand for resources to support progressive MS research. From the 195 applications, through a very rigorous peer review process that included 41 experts from 11 different countries that reviewed these applications and prioritized them on behalf of the alliance. They chose 22 out of the 195. And to be clear, each application or each award is for approximately 75,000 euros. Since this is an international effort, our currency is in euros, which is the equivalent of about 100,000 US dollars. We awarded 22 of these. So this is somewhere on the order of about 2.2 million US dollars for each award, or for this funding cycle.
So we're certainly in a period of time where funding for research is under pressure. Is there a sense that these types of models are going to become more important to do early stage research to find new therapies for diseases like progressive MS?
Yeah, I think you hit the nail on the head there, Daniel. I mean, the federal government support for research in general and MS research specifically is generous and it's impactful, but it is slipping over the course of the last few years. So the role of organizations such as the National MS Society and the Progressive Alliance is more critical now than ever before to fill in the gaps that are being left by this shrinking support of biomedical research by other sources. So that it comes at a really important time so that we can maintain momentum that's been that's growing and being established in progressive MS research. It's really a critical time, and it's very important for organizations like ours to fill in the gaps that government research is leaving behind.
It's still early days for the Alliance, but would you say there are benefits of working in this way together? And do you see other disease groups looking to this as a model for ways they could move forward?
Yeah, so I think there's some really interesting, in addition to, of course, catalyzing MS research around the world. I think some other interesting benefits include the ability of our organizations to convene researchers in meetings on a regular basis to get scientists to talk to each other and share information and advances in research. And that's another way that we can advance and speed up progress in MS research. I think the other interesting aspect to that question is that we're all learning from each other. So we all have our own best practices. We all have our own strategies for how we're reviewing grants and evaluating opportunities. And it's been a very interesting experience to learn more about how the other organizations address those challenges of reviewing grants and making decisions. And I think we're all learning from each other about and improving all of our processes, and so that we are better at our jobs and can advance the field of MS research faster and with more vigor than we could otherwise. So I think that's another sort of interesting aspect to this that we don't really talk about very much, but it was a great question because I think it's another interesting aspect. And as far as what other organizations or other disease groups are doing, it's not particularly familiar with any other efforts, and maybe that says something about what's happening, in other areas.
Bruce Bebo, Executive Vice President of Research at the National MS Society and a member of the Scientific Steering Committee of the Progressive MS Alliance. Bruce, thanks so much for your time today.
It was my pleasure, Daniel. Thank you.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.